So for my clinical case presentation, I will be discussing a 15-year-old male brought into the clinic by his mother for acute pain to the right lower quadrant of his abdomen and his right testicle. Patient stated that while doing deadlifts at football practice, he pulled up in an explosive form and felt a pop in his right lower abdomen, and he fell to the floor in pain. Mother further states that he has complained of pain to his testicular area since Saturday after his track meet where he participated in hurdles. Review of systems. General. Patient is age appropriate with no developmental concerns, stated by himself or mother. No unusual weight gain or loss, no temperature sensitivity, no general malaise or fatigue reported. Skin. No complaint of rashes, dryness, no petechiae or itching. No concerns with hair. Head, neck. Mother and patient state no complaint of headaches, injuries, stiffness, pain, or masses. Eyes, ears, nose, and throat. Mother and patient deny any sore throat, sores, or lesions in the mouth. Patient denies any eye pain, itching, redness, discharge, or swelling. Patient denies any ear pain and or discharge, denies congestion, nosebleeds, rhinorrhea, and sneezing. Respiratory. Patient denies any dyspnea, no coughing or difficulty breathing at any time. Cardiovascular. Mother and patient deny abnormal history, no palpitations, no syncope. Patient denies chest pain at any time. Gastrointestinal. Patient denies nausea and vomiting, no diarrhea. Patient denies bloody stools, no constipation. Patient states he has pain to his right lower abdomen and it feels better when he applies pressure to the spot. Genitourinary. Mother and patient deny abnormal history, no dysuria, no increased urge or frequency, no hematuria, no discharge. Patient states his right testicle groin area hurts and feels like maybe he pulled something. Musculoskeletal. Mother and patient deny any abnormal history, no concerns, no pains in the joint, no swelling, no stiffness. Neurological. Mother and patient deny any abnormal history and or concerns. Endocrine. Again, mother and patient denies any abnormal history and or concerns. Hematologic. Mother and patient deny any abnormal history and or concerns. No bleeding, no easy bruising, no swelling of the lymph nodes. Psych. Patient and mother deny any issues, no anxiety, no depression, no difficulty sleeping, no hyperactivity and or difficulty focusing. The patient is currently not taking any prescribed or over-the-counter medications, no known drug allergies, no seasonal and or food allergies. Mother and patient deny any past medical history and or problems out of the norm, and patient has not been in the hospital since he was born with no complications. Family history. Mother denies any abnormal medical history within the family. This 15-year-old boy is a sophomore in high school. Mother and patient deny any social concerns. Patient states he does not get bullied. He participates in football and track and gets along with most everybody. Working differentials for this case include inguinal hernia, appendicitis, and acute muscle strain. Vital signs. This patient's temperature was 98.7. He weighs 159 pounds, which places him in the 90th percentile. He is 5 feet 10 inches, which equals 70 inches. BMI is 22.9, which places him in the 80th percentile. Blood pressure was not obtained at time of vital signs. Upon physical exam, patient is generally appropriate and polite for age. He appears with no general malaise and or fatigue. Cardiovascular, normal sinus rhythm, no bruit or thrills noted. Respiratory, even and unlabored, no wheezing noted, no rales or rhonchi. All other areas are clear to auscultation. Gastrointestinal. Abdomen is soft to palpitation, non-distended. Patient flinches when palpated to right lower quadrant. No masses present. Bowel sounds are present in all 4 quadrants. No vomiting or nausea. Genitourinary. Patient states right testes is sore to palpitation. No hernia felt upon assessment and no further masses. No lab tests were ordered at this time. Patient was sent for a stat ultrasound to include testicular, abdominal, and inguinal areas. Prior to results of ultrasound being received, patient was diagnosed with unspecified abdominal pain, ICD-10R10.9. Upon receipt of ultrasound results, patient was further diagnosed with a varicocele, ICD-10I86.1, and a hydrocele, ICD-10N43.3. Refuting data for my differential diagnosis are as follows. For the inguinal hernia, there was no hernia palpable upon assessment, and the ultrasounds showed no signs of hernia. For appendicitis, patient had a negative Rosing sign, negative SO sign, and negative arbitrator sign. Upon ultrasound, no signs or symptoms of appendicitis present. Acute muscle strain, the ultrasound shows varicocele and hydrocele, which explains his pain and explains or rules out muscle strain. Plan includes medication, alternating Tylenol and ibuprofen over the counter every 4 to 6 hours. Patient may take 325 milligram capsule of Tylenol, alternating with 400 milligram tab of ibuprofen every 4 to 6 hours for mild to severe pain. As previously mentioned, the diagnostic studies included an ultrasound, which included testicular, abdominal, and inguinal areas. Modalities for this patient includes discussing not participating in any sports, to include football and track, which are his current sporting activities in school, plenty of rest, and alternating the Tylenol and ibuprofen PRN for pain. Follow-up was indicated. He returned to the clinic for his ultrasound results within 1 day. Patient was further referred to a urologist for further treatment and management. Patient was educated on the cause of hydrocele and varicocele, as well as importance of following up with the urologist. Patient does have a urology appointment coming up in May. There was no need for a quicker assessment by the urologist for mild to moderate pain, which is what the patient is currently feeling. Clinical guideline was used in diagnosis of the hydrocele and varicocele. Patient was assessed to rule out any other possible differential diagnoses, including appendicitis and inguinal hernia. Patient was then sent for ultrasound, which is the recommended diagnostic study for a varicocele and hydrocele. I think that this clinical case was something different that I hadn't seen before. Prior to entering the room, I thought for sure that this student or patient was experiencing an inguinal hernia based on what the medical assistant had charted in the document upon interviewing the patient. As I entered the room, the patient did have his hand pressed firmly to his right lower abdomen. I did the Rosing sign, I did the arbitrator sign, I had him cough. I did multiple things to assess for a hernia and or appendicitis. At this point, I was thinking it was a simple muscle strain from explosive deadlifts and or his hurdling from the previous Saturday's track meet. Because he felt and explained that the pain lessened while laying down and while applying pressure, myself as well as my preceptor felt that it was important to get stat ultrasound to rule out any possible emergency situation. Patient did return to the clinic the following morning and was diagnosed with the varicocele and the hydrocele, and then was further referred to Dr. Latif for urology. An appointment is set up, and patient was educated on taking Tylenol and ibuprofen for pain until he was able to be seen by the urologist.